Pes planus. You wouldn't wear mittens all day to use your hands. Why wear shoes and orthotics? First of all, I want to thank you for spending a few minutes with me to talk about my flat feet. And I'm Baram Jam. I'm a physical therapist in Toronto. Here's a picture of my left foot, which I'm quite proud of. I have a similar one on the right side. For the last 10 years, I've been running in my Vibram 5-finger toe shoes, and although it looks weird, it seems to satisfy my needs when I run. I don't necessarily recommend this for everyone, but it works for me. The feet of land mammals, our ancestors, have spent about 265 million years evolving. Humans' feet have spent about another 7 million years in the making. The supportive shoe and orthotics industry have spent about 40 years in the making. So the jury's still out whose side we should take. The fascinating thing is we have similar skeleton in our feet as we do in our hands. We have similar muscles that we have in our feet as we do in our hands, the same intrinsic and lumbrical muscles. Now, would you wear mittens to use the phone or to do any activity that requires dexterous hand movements? The answer is of course not. You wouldn't peel a banana with your mittens. My daughter got frustrated as I was taking pictures of her. She said, "Do I have to do this?" I said, "Yes, because I can't play the piano with my mittens on." I said, "Exactly. I can't play the ukulele with my mittens on. Why would I do that?" I said, "Exactly. So why do we wear these rigid orthotics and these hard-fitting shoes all day that compress our toes together?" Each foot is home to approximately 7,000 nerve endings, and the information they receive and pass on to the rest of the body is extraordinary. When feet feel the ground, the thousands of receptors in the nerve endings send feedback to the rest of the entire nervous system. As you can see, those nerve endings are just plenty in our feet, and our ancestors stimulated every one of them. Sadly, we don't seem to do it as much anymore because we technically avoid walking bare feet, including we tell our children not to walk bare feet. To simplify the intrinsic foot muscles, I've divided them into 3 layers. We have the abductor hallucis, adductor hallucis, and the abductor digiti minimi. We have the flexor digiti minimi and flexor hallucis brevis in layer 2. And layer 3 consists of the plantar and dorsal interossea. And the function can be said to abduct and adduct the toes and flex the MTP joints. But I'm going to say the most important function is to provide proprioception for the foot. The abductor hallucis and the adductor hallucis have the greatest cross-sectional area. So they're considered to be the most dominant intrinsic foot muscles. So when there are studies looking at the IFMs, which I mean intrinsic foot muscles, they primarily measure the cross-sectional area of the abductor hallucis. As you can see, is the largest one. Let's see if we can fill in the blank. Although there is limited research to date, it can be hypothesized that the intrinsic muscles of the feet may be valuable for stability control and something of the foot during all functional activities. The blank is proprioception. Loss of motor control has been shown to occur in the lumbar spine, the thoracic spine, cervical spine, the shoulder, the hip, the knees. However, I have no studies yet to support the loss of motor control specifically in the feet. Now, of course, there's lots of studies to show loss of proprioception in the feet and balance. There's some theories that the intrinsic foot muscles get overused when you get myofascial pain. This is shown in the Travella and Sims textbook of trigger points, and there suggest supportive orthotics when this happens, or massage. The intrinsic foot muscles have been shown to be functionally more active in pes planus than non-pes planus people. Therefore, the hypothesis, it's at greater risk of overuse, which makes sense. Flat feet people may have more myofascial foot pain because they use them more. IFM trigger points can be increased by tight-fitting shoes, and they may be increased by rigid orthotics. So why not focus on IFM endurance, retraining, and control to prevent fatigue, rather than just putting in orthotics? The study goes back to 1968, and they showed that flat-footed persons had greater IFM EMG activity than normals. This seems to make sense to me. Another study going back to 1985, greater EMG activity of the abductor hallucis was demonstrated in individuals with flat feet in single leg standing during gait. Again, That makes sense. Let's move forward to 2003. Navicular drop measured before and after tibial nerve block posterior to the medial malleolus to deactivate the abductor hallucis muscle was done. So this study, as you can see in the images, they did a nerve block and they wanted to see, do the intrinsic foot muscles contribute to the medial longitudinal arch? And they found that there was a small, 3 millimeters, but significant increase in the navicular drop after the block. So you must appreciate that 3 millimeters was the mean value. They found that some people dropped more than 3 millimeters while some people didn't drop any. Perhaps the intrinsic foot muscles contribute differently to the medial longitudinal arch in different people. Navicular drop measured before and after repeated submaximal IFM exercise to fatigue the abductor hallucis muscle was done. And then they used surface EMG to confirm the fatigue. Basically, they attached a little weight and a rope to the foot toe, and they got them to flex their toe repeatedly until they got tired. They said, I can't do it anymore. Then they found that the navicular drop significantly increased after fatiguing the exercise of the IFM by 2 millimeters. Again, 2 millimeters doesn't seem like much, but in some people it was more, in some people it was 0. But it seems like the IFM, or in the intrinsic foot muscles, do contribute to the medial longitudinal arch. It was demonstrated that fatigue of the plantar IFM leads to an increase in foot pronation. So how do we retrain the intrinsic foot muscles? How about the intrinsic foot muscle exercises? I'm going to suggest that this is not the best way to retrain the intrinsic foot muscles. They do train the superficial feet muscles, such as the flexor hallucis longus and the flexor digitorum, but not necessarily the foot muscles. Now, I'm not against doing towel toe curls, which I do prescribe to my patients post-ankle surgeries, those who need general exercises, which I'm all for. However, if I really wanted to evaluate and train the intrinsic foot muscles, I would use the short foot exercise that has been shown in yoga and yoga exercises, and also Vladimir Yonda also described these as being the short foot exercise. To do this, you stand on your feet and you increase your medial longitudinal arch. What you don't want to do is curl your toes, because that's considered an incorrect pattern, like the image on the left. What you want to do is activate the intrinsic foot muscles by just shortening the feet. You have to keep the metatarsal head of the big toe and the heel continuously down on the floor. And you're slightly increasing the weight load on the lateral aspect of the foot. One of the ways to do this is to do a yoga exercise. So please stand up. Get up on your feet right now. Don't continue on unless you do this exercise, or else it makes this whole video pointless. Stand on both feet first. What I'd like you to do is lift your toes up all the way. This causes a windlass effect and naturally forms a medial longitudinal arch. Now what I'd like you to do is slowly drop one toe at a time, starting from your baby toe, and then the fourth toe, and then the third toe, and then second toe, and the fifth, and the first toe. But maintain the medial longitudinal arch. Now, this is considered to be the neutral position of the foot, where you're in subtalar neutral. That's the hypothesis. Hold that position for, 5-10 seconds, then slowly go back to being into your natural flat foot. Now, people who are already in neutral pronation, neutral subtalar, or people who are pes cavis will not be able to do this exercise and will have no clue what I'm asking them to do. However, if you have pes planus, you can appreciate that this is not such an easy exercise to do. Do it once again on both feet. Stand up, lift all your toes up, and slowly drop one toe down at a time and maintain that medial longitudinal arch. And just hold it there. Shouldn't be that difficult. I do this exercise every morning as I'm brushing my teeth, as I'm shaving. I just naturally think of stimulating my intrinsic foot muscles. To make this exercise harder now, hold on to the back of a chair or a table or a wall. Now stand on one foot. Maintain the medial longitudinal arch. Hold it there 5-10 seconds and slowly drop after 5 seconds. Now you can make this harder. Stand on one foot and close your eyes and take your hands away from the wall. Hold it there 10 seconds. I want you to do this. Don't continue on unless you're doing this. Maintain the medial longitudinal arch. Consciously, you're giving proprioceptive feedback into the feet. Now, can the intrinsic foot muscles be strengthened? That is the question. This study examined the effects of foot orthosis, and IFM exercises on the cross-sectional area of the abductor hallucis muscle and strength of the flexor hallucis in subjects with pes planus. Subjects with pes planus were randomly assigned to one of two groups. Half of them received just foot orthotics, that's it. The other one received foot orthotics combined with intrinsic foot muscle exercises, similar to the ones that we just did. And they did these exercises for a period of 8 weeks. What they found was that the cross-sectional area of the abductor hallucis muscle and the strength of the flexor hallucis significantly increased after the intervention in both groups. That's amazing. The orthotics group also improved in their strength and their cross-sectional area. However, result number 2 showed that the mean cross-sectional area of the abductor hallucis muscle and the strength of the flexor hallucis were significantly greater in those who also received IFM training. So it seemed like IFM training actually works. Conclusion, perhaps IFM training is not a waste of time and that it's possible to increase the size and strength of the foot muscles. Is IFM training clinically relevant though? The answer is, we don't yet know. We have no study yet to show the improvements in size and strength actually correlates to improvements in pain and functional scores in those with actual pronation issues. So can IFM training actually change the medial longitudinal arch? In this unique study, asymptomatic subjects, 42 feet, completed a 4-week IFM training program as they investigated changes in the medial longitudinal arch height, balance, and the amount of navicular drop. A navicular drop measures the amount of subtalar joint pronation you have indirectly. And what they found was that there was a small but significant increase in MLA height, and there was a significant improvement in static single leg balance. Result number 3 was there was a significant increase in dynamic balance, for example, as measured in the star excursion reach. And number 4, the navicular drop decreased by almost 2 millimeters after 4 weeks of training and by 2.2 millimeters after 8 weeks. Again, that doesn't seem like much, and it isn't. However, in some people the increase was greater and in some people it was nil. Now what they found that those with greater than 15 millimeters of navicular drop at baseline had a greater decrease in navicular drop of 6 millimeters. Those with navicular drop of 6 to 9 millimeters had almost no change in their navicular drop after 4 weeks IFM training. So what that means is those who have pes planus to begin with seem to show greater improvements in the medial longitudinal arch versus those who already have neutral feet anyways. So people with my feet perhaps should be doing IFM exercises. Conclusion, this is the first study to demonstrate that IFM training may be valuable in statistically and dynamically supporting the medial longitudinal arch. What I'd like to go through is some traditional concepts and new proposed concepts about the intrinsic foot muscles. Now, I spoke at a chiropody conference several years ago, and somebody questioned me, a chiropodist, said, basically, Baram Jam, all that talk about intrinsic foot muscles is a waste of time because there's no way that retraining the intrinsic feet muscles can have an effect on the medial longitudinal arch. Now, was he correct or incorrect? I'm going to say he was both correct and incorrect. The reason I do intrinsic feet muscles is not to increase my medial longitudinal arch because I've been doing that for years and I don't think there's been much change in my IFM. But I don't care about how much I pronate. I care about how much control I have into pronation when I walk, when I run, when I jump, when I play squash. So let's go through traditional concept. Excessive pronation is the primary biomechanical cause of many foot and ankle disorders. What I propose is that lack of control into pronation is the primary biomechanical cause of some foot and ankle disorders. Traditional concept is that supportive shoes and permanent rigid foot orthotics are clinically essential and should be the primary management option for many foot and ankle pain syndromes related to abnormal pronation. However, the new proposed concept is that in conjunction with temporary orthotics, retraining of the IFM may also be clinically valuable for some foot and ankle pain syndromes related to abnormal pronation. Traditional concept is that The primary purpose of retraining of the intrinsic foot muscles is to change the static foot posture and the height of the medial longitudinal arch, which I don't agree with. It hasn't happened to me. The primary purpose of retraining of the intrinsic foot muscles is to help dynamically control the medial longitudinal arch following heel strike. And intrinsic foot muscles can be retrained using phasic towel toe curls. Again, I'm not against towel toe curls, which have their place in some patients. But intrinsic foot muscles may be effectively trained using specific tonic exercises in isolation of the superficial muscles, as we already reviewed. Here's another picture of my left foot. It's served me well in the last 48 years, and I hope it continues to serve me well. Now, you wouldn't wear mittens on your hands, and we wouldn't put mittens on our children as they start using their hands. So why do we put rigid shoes on our children as they start to walk? So for the complimentary full article on this topic, you can visit aptei.ca and just go under clinical articles. I hope you enjoyed this short presentation. Thank you.